marks the end of our first session for this discussion. So Dr. Saver, Shannon, Ms. Geda, and
Namaste.
Thank you very much for your time and absolutely valuable lessons on data that you have given us, in the progress for women's, children, and adolescent health. And we will go straight into the second half of this discussion because we need to look at, we've looked at the 10 years that have passed. Now we need to look at the decade of action, and that's the decade ahead. We need to look at solutions, investments, and accountability that we need to get us back on track to achieving the Sustainable Development Goals. And now allow me to welcome on the virtual stage our esteemed panelists for the second part of the discussion, Ms. Ana Claudia Carleto, Secretary for Human Rights and Citizenship of the MONUSCO, has lots of resources to manage. But how do we ensure that there is proper balancing of resources and priorities so that not all human and capital resources are geared towards COVID-19 efforts at the expense of other essential services like, and especially provisions for women and children? And you can give us, your experience from the municipality of Sao Paulo. How are you doing it? How are you, managing those resources to ensure there's that balance? Sorry, we cannot hear you with Ana Claudia, so I think you are on mute. No, I think you are still on mute. As you sort that out, maybe we can move to Beth. Beth, are you ready?
I'm ready, thank you.
Oh, great. So, Ana Claudia, I'll come back to you in a minute. Maybe we can just sort out your audio. And, Beth, I asked Ana Claudia, the issue of managing resources, and I'm coming to you because, Every Woman, Every Child report shows that, there are billions of resources in US dollars that have been mobilized in financial commitments. We're talking about about 44 billion USDs, in terms of financial commitment. And they were talking about an addition of about 97 billion USD pledged by India. And this is just essentially to advance the health and well-being of women, children, and adolescents. What has the impact of these investments been on the health and well-being of this group over the past decade? And how do we ensure that we protect, the investments that have been made, especially during this COVID-19 period, seeing just how disruptive it is on the progress that we are making?
Thank you so much for that question, and it's an honor to be a part of this panel where I know everybody here will have really important perspectives on these issues with regard to financing and accountability. I really want to thank, as well as the previous panel did, Every Woman, Every Child, the Secretariat, PMNCH, and White Ribbon Alliance. It's a great session here to be a part of, and really critical issues that we have before us. And as you mentioned, the $44 billion that have been mobilized represent the cumulative effort of almost 350 commitment makers spanning across sectors and issue areas. At FP 2020, we've been specifically focused on mobilizing support and commitments to advancing family planning, which we know is foundational for enabling women and girls to live fuller and healthier lives. And conferring health services, family planning has experienced one of the most profound and severe disruptions, with nearly 70% of countries reporting some disruption and almost 10% reporting severe or total.
Well, thank you very much. And, on that note, let me just come to Joy. Dr. Heather talks about, these millions of dollars that, have been input into women, children, and adolescent health. And, even when we talk about COVID-19 and managing, how we are responding to the needs of this group, we are still seeing reports of embezzlement of funds and, sorry to say, people in government just going haywire with money that is supposed to be channeled towards COVID-19 and women, children, and adolescents. The 2020 report of the Independent Accountability Panel raised an alarm on this and warned that an estimated 20 to 40% of health expenditure is wasted globally due to inefficiencies and corruption. how does this affect our fight for proper health and well-being of women, children, and adolescents? And as countries or organizations, we need to ensure full accountability, which connects commitment to progress, right? How do we do this with all that's happening?
I would like to thank PMNCH. I would like to thank Every Woman Every Child Right to Born Alliance and members of the panel. Indeed, corruption is root in the health sector globally, whether it be in domestic public. COVID-19 is teaching us that very, very effectively. They must be based on the rights of communities, of women, children, and adolescents, and the rule of law. And
it's become pretty difficult to get what you are saying comprehensively. So please allow me to interrupt you a bit as you try to maybe sort that out and move back to Ms. Ana Claudia Caleto. Are you back on? Say something. Hi.
Hi.
Great. Yes, I can hear you now. Sorry about those audio issues. And we can now hear you clearly all the way from Nairobi, and I bet everybody from the 109 countries are hearing you nicely now. And I just pulled to you a question about, our resources and they being infinite, and, just how to manage and balance these resources to ensure that we do not, cut what should be directed towards responses on women, children, and adolescent issues and their health and well-being in favor of, working on other issues relating to COVID-19. As much as we appreciate this is a global pandemic, there must be a lot of resources that must be channeled towards that. But how do we get that balance to ensure that we do not do this at the expense of women, children, and adolescents?
First of all, good morning at all. I'm glad to be people, especially during this pandemic. Take care of them and listening to their demands as a center of goals of this mandate. In terms of essential health, São Paulo built 3 field hospitals in order to guarantee that everyone will have access to public health, relieving the public hospital network. Thanks for this decision, the city never had to decide who would live and who would die. During the COVID-19 pandemic, the mayor also created a program called Solidarity City. Since May, we have bought more than 1.5 million food and sanitary kits to vulnerable people in São Paulo, distributing these items in partnership with the Red Cross and NGOs working directly with women, indigenous people, migrants, the elderly, etc. Of course, there are specific actions taken by each office during the COVID-19 in the case of the
and Claudia for those comments. And, you are talking from, your experiences and what is happening in Sao Paulo municipality. And, we have somebody from the Global Financing Facility here, Dr. Monique Leder. And even as we reflect on what Ana Claudia had said, let me just ask you, she's talking about, what they have prioritized as a municipality in the country. And I think of your role at GFF as an entity that is supposed to help governments to transform how they prioritize and finance the health and nutrition of the. And I think that role is really key, especially now. And when we think of focusing on care during pregnancy, birth, and early years, adolescence, and primarily just general care for women. So could you just explain how GFF is supporting countries right now in their own response to decisively save lives and protect the delivery of essential services as part of trying to navigate this pandemic, get out of this pandemic and even thrive after the pandemic is done?
Great. Thank you so much, Mercy. It's really an honor to be here this morning. I'd like to also thank the organizers, and it's so wonderful to see so many colleagues and old friends. It's a shame we can't meet in person, but it's really great we can have this conversation. And so for the Global Financing Facility, we have since COVID started, worked with the 36 countries that are currently part of the GFF program to look at, with the Ministries of Health, to look at the essential services and are the services reaching women and children. And last week we released a press release with the analysis of the first 10 countries, 63,000 health facilities, really showing, even though there's quite a variation between the different services and between countries, we're showing quite a severe impact on the disruption of essential services for women and children. And just to give you an idea, for example, in Nigeria, we saw a 16% decline in antenatal care. We see across the board significant decline, sometimes up to 30% of outpatient visits, as well as child vaccinations. And so, taking that into account, when we started seeing that in February and March, we immediately set up a virtual programmatic policy platform for all of our countries to participate, look at this data, and based on their local context and country needs, to design and finance programs that can address these challenges, to really ensure that we can continue those essential services on country level. And it's really great to see how around the GFF the partnership comes together, and we saw a tremendous engagement of civil society from very early on in the COVID response to really ensure that there was sufficient advocacy around the issues for women and children. We're also looking at the issue of supply chain, and so there's been quite a lot of disruptions in availability of important commodities that will allow quality of care for women and children. And so we're looking into the local production of protective clothing for health workers so that they can continue staying on the job, as well as for certain commodities, particularly for Africa, so that they become less dependent on global supply chains for those important commodities. And maybe just to close off, because I know you want to keep time for discussion, which is always the best part, we are launching the new strategy. We're at 5 years of implementation, and the doubling down, the COVID crisis has more than ever shown the importance of a functioning health system, and so we're doubling down on the essential services and the system strengthening agenda in collaboration with partners. But I also just want to build on what Joy was saying around the accountability, the importance of the voice of women in shaping health services, and that also includes a really big emphasis we want to put on female leadership. When women are in decision-making positions, it's very well documented that they make decisions that really take into account the needs of women and children, and we want to further strengthen that and ensure that we have not only as health workers, nurses, women contributing to healthcare, but that also in the decision making, including on financing, women can take the lead on ensuring that we have a better future for all women and children and adolescents. Thank you.
Thank you very much, Dr. Monique. Now, and I'll come now to you, Toyin. All the speakers that have spoken before you are talking about financing, and talking about resources and good tech. All these then comes so many innovative solutions to addressing gaps of women, children, and adolescents. But when we talk about technology and innovative solutions, we also have to talk about broadband and social media, and how to use this from service delivery to self-care and information sharing. But this is not really the reality for many people who are maybe living in places where there's no internet and all that, and there's this digital divide. How do we ensure that no one is left behind, even as we focus on financing and technology and building resources, and as a way of rebuilding our system after COVID-19 and in preparation for future pandemics? How do we ensure that no one is left behind, and that digital divide or that digital gap is really minimized, if not eliminated?
Okay, thank you so much, Mercy, for your question, and thank you very much to PMNCH for the opportunity to be a part of this conversation. I'll start by saying that the solutions that we have to provide, they have to be multi-component solutions, and they have to fit our context. These solutions have to take into consideration the fact that adolescents and young people are not a homogeneous group, and so they have to be tailored to their needs. And of course, we have to work in partnership with adolescents and young people to tailor the solutions and ensure that it suits their needs. Having said that, digital solutions, yes, they do have a great potential to reach adolescents at scale wherever they are. And I'll share our experience at Education as a Vaccine, a youth-focused organization in Nigeria. We've been using digital platforms to provide sexual and reproductive health information to adolescents and young people since 2005. We started with learning about living. This was an electronic curriculum that provided life skill information, sexual and reproductive health information, and it was web-based. And so young people would have to go to cyber cafes. At the time, this was the easiest way to get access to the internet as a random person. Of course, this has its own challenges. And so with feedback from young people showing these challenges and stating these challenges, we then evolved to providing hotlines services, and then also expanded to a service we call the My Question and Answer service. So this is like an SMS-based service, so a short message service, just sending text messages to a short code. And the platform was created for young people to ask questions and get accurate answers from a trained counselor on the sexual and reproductive health, even their relationship concerns, and it was for free. So from any mobile phone, they can send a text message to that short code, and the service is anonymous, it's confidential, and it's a non-judgmental service. We've reached over 1 million young people in Nigeria since inception. And we've worked with young people over time who themselves are telling us what works for them.
And much, Korean, we could go on and on about the decade ahead, and because there's so much to discuss. And I know we were looking forward to a little bit of a chit chat back and forth between us, but because of time, unfortunately, I had to end it here. So thank you very much, Anna Claudia, Wade, Dr. Blada, and Toyin, and Joy, for the wonderful insights on how to ace the next decade. And my key takeaway from these deliberations are that even as we celebrate progress globally, we should be careful to note that the progress is not equal, and still there are many other regions where women, children, and adolescents' health and well-being are doing so badly. And we have learned of the need to address the gaps and challenges that the global community must urgently act on to ensure that we just have more investments in sexual, reproductive, maternal, newborn, and child health. And even as we seek more investment, especially on the financial front, then the big question will be, how are we utilizing this money? If it's going to the intended recipients, is it going to the most vulnerable? And we should not forget that data and evidence are powerful tools in advocacy and decision making. So thank you very much, our esteemed panelists, for your time and your really, really valuable information. We really appreciate. And on that note, I will transition to the next session, and we are calling this Brave Voices, Bold Actions, delivering on what women, adolescents, and children want during COVID-19 and beyond. Now, from Uganda to Mexico, Nigeria to Brazil, the US, and DRC, all over the world, there is one deep desire, genuine desire from women, and that is to be heard. The What Women Want campaign has been described as the largest ever open-ended survey into women's opinion on their own needs for quality and reproductive and maternal health care. It is the authentic, brave voices of 1.2 million women of all ages from all walks of life from more than 100 countries. Now, these women were asked about their top priority for quality maternal and reproductive health care services, and they gave a list of demands. And these are demands that they want political commitment, investment, and accountability on. This next session is what I think of as Citizens' Parliament. Basically, we're giving the voice to the people, but not only the people, this is also a moment of discussion on both leadership and citizenship, and we are seeing these people come together and just reflect on all these words. And speaking of citizens' voice, Let's first begin by hearing from women and young people themselves in this video from What Women Want campaign convened by White Ribbon Alliance.
All right, video is rolling. I am going to admit those in the waiting room now. Joining us from the waiting room, we have a video rolling in the live feed now. I see some empty rooms. If you could go video off until Mercy brings you into the live feed. We might need to kill this one. All right, video is rolling in the live feed. We are moving from this video to a second video with Rena, and then into the panel with Harsh, Pauline, and Margaret. Just making sure we have Harsh, Pauline, and Margaret with us. Dr. Harsh. So as you hear your name called by Mercy, you can come up on video and up on audio. So yeah, if you could just mute your audio, Dr. Harsh, and video off for now. And this looks like it's working great. And Professor Kobia, we see you. Can you do a quick audio check? Dr. Kobia, can you just do a quick audio check? Can you hear me? I want to make sure I can hear you.
Yes, I can hear you.
Excellent. Okay, so you can stay video off and audio off. Dr. Harsh, could you go video off, please? And also give me a quick audio check. Dr. Harsh, can you say hello, please?
Yes, I can hear you. Thank you.
Excellent. We can hear you as well. If you're able to go video stop, that would be wonderful.
Yes.
Mercy, the video is rolling. If we can come back live to you. And I believe you're going to go to Rena, which is a video message first. Is that correct? Mercy, can you hear me?
Yes, Sam, I can hear you. Can you hear me?
Yep. All right, we're good. So the video is rolling. I'm showing on the script that there's a video response from Rena that is up first. Is that still accurate?
Yes.
Great. So we'll have that one ready to roll. And then all other panelists, as Mercy brings you into the live feed, just go video up. And we are going back. Stand by. Coming back to you momentarily, Mercy. Back to Mercy in 3, 2.
Ladies and gentlemen, now more than ever, it is time to listen and act on these demands. Already this pandemic is disrupting so much, the provision of life-saving maternal services and adolescent health services. It is eroding sexual and reproductive health and rights of women and adolescents. And we're just seeing an exacerbation of systematic and structural racial, ethnic, and gender inequities everywhere. In July, we had the Lives in the Balance virtual summit on COVID-19 and women, children, and adolescent health. And there we launched the PMNCH call to action on COVID-19. And there were 7 asks to governments for greater action on, and asking for investment, policy, and service delivery. And you can see these asks in depth on the PMNCH website. So in this next forum, we bring forth dialogues between women and decision makers based on 4 main asks. We are going to look at respectful and dignified care, clean health facilities, toilets and water, what we, refer to as WASH. And then we're going to look at essential sexual and reproductive health, medicines and supplies, and finally at more and better trained nurses and midwives, because essentially that is very important, especially during this time. And before we get into that conversation, again, I just want to ask our audiences, please do keep the conversations going in chat. And this time, I want you to let me know your name, your country, and tell us that one demand or issue for more action on COVID-19, and what you're just asking the various decision makers, whether they are on the panel or those who are watching this or those who will watch this, because this will be online for quite a long time, what you want more action on COVID-19. So put that demand or that issue you want to address, you want more action on the chat box. And my colleague Jane is keeping an eye on your responses, and maybe we can look at some of those responses after the first panel and at the end of the session, Jane. So for now, let's get the conversations going on our virtual stage. In our first panel, we'll be discussing issues around respectful and dignified care and water sanitation and hygiene, like I mentioned. So joining me on screen is Honorable Dr. Harsh Vardhan, Union Minister for Health and Family Welfare, India. Thank you so much. Really good to see you with your mask on. And then we have Ms. Pauline Nyona from the Organization of African Youth Kenya and PMNCH NYC member. And lastly, we have Honorable Professor Margaret Kobia, Cabinet Secretary, Ministry of Public Services and Gender in Kenya. Welcome. In Swahili, we say Karibu Sana, Dr. Harsh Vardhan. It's really, really good to see you. But as you just get comfortable in all this, first, let us watch this video testimonial done by Reena Yadav, member of Legislative Council Bihar in India.
All right, video is rolling in the live feed. Everyone just stand by. Dr. Harsh, where's Coach? Oh, yeah. All right, we're seeing all four of you. You can all go unmute now as well, and I'll do a countdown back to Mercy. Yep, Professor Kobia, you can leave your video up. Start video and leave it on. Perfect. Pauline, same with you. Fine to leave your video on. Excellent. All right, so Mercy, we have Dr. Harsh, Pauline, and Professor Kobia all set. We'll give you the countdown coming back live to you. All right, stand by. Video of Reena is continuing to roll. We'll come back to Mercy. Continue to stand by, coming back live to Mercy momentarily. back to Mercy in 3, 2.
Dr. Harsh, I will come straight to you. You have seen Rena's video, and she raises some points on quality, respectful, and dignified care. Now, India remains one of the most high-risk places in the world to give birth, and almost all the deaths that occur are preventable. But even as we know that fact, we know that there have been processes and all these measures put in place to try and continue decreasing India's maternal mortality rate. What are you doing to make this a realization? What are you continuing to do to ensure that this fact is eliminated and basically we see a continual decrease in maternal mortality rate in India, especially when it comes to that aspect of realizing women's right for quality and respectful healthcare?
Thank you, Mercy, for that vitally important question. And I must admit that I and my government have been trying to address this issue on priority. This sentiment was echoed by Ms. Reena Yadav, whom you all heard, and it is so very heartening to see that local leaders and their voices are getting global platforms and recognition to showcase the tremendous lift that local administrations have made in the past few months despite the pandemic. Regards your question, we reckon that maternal and maternity care goes much beyond only healthcare services for the mothers, but sets into motion an experience for lifetime. It's the lived reality of a woman who depends on a responsive system to cater to her needs of not only services but also dignity, privacy, confidentiality, choice, and respect for her as well as her baby. It is not just about a provider or a client, it's about human dignity. That was the reason that our government has been working in an incremental manner to provide respectful maternity care. From instilling a behavior change to help more women deliver in hospitals, to entitlements for absolutely free services, we have come a long way now in providing quality care throughout the pregnancy and childbirth with interventions like Lakshya and midwifery care. Last year, I started a Safe Motherhood Assurance Suman initiative that brings all these services under one umbrella. We are now following a zero tolerance approach for service denial to pregnant women and their newborn babies, and have also strengthened our system for client feedback, grievance redressal, and greater accountability and transparency. The idea is to have a fully responsive and accountable health system that will not only result in a positive birthing experience but also help end preventable maternal and newborn deaths.
Wow, thank you, Dr. Vardhan. And you talk about human dignity and having a responsive health system to take care of maternal health and to end the preventable deaths that we are witnessing. Now, I will come back to you shortly, but before then, let me tell you, ladies and gentlemen, a little story that really saddens my heart. 2 weeks ago, there's a video clip that went viral on social media in Kenya, and this video was played on news in major television stations. It shows a man emerging from a car at the gates of Kenya's largest maternity hospital, and this is Pumwani Hospital. This man was carrying his pregnant wife who was in labor. She was crying and in need of immediate attention, but they were denied entry into the hospital and told that the medical workers were on strike. The woman was overwhelmed with labor pains. She could not make it to another public hospital and she could not afford to go to a private facility. Now, ladies and gentlemen, right outside the hospital, which sits in front of a really busy highway with hundreds of cars and people passing by, this woman lay down, wailing, desperately calling for help, and a few minutes later, she gave birth on the tarmac road, right outside the hospital gate. Zero privacy, tens of onlookers, some filming her ordeal on video. You know, that video is still trending, and the internet never forgets. The video will still be up for years and decades. Just picture the disrespect and the indignity. Professor Margaret Kobia, this happened in your country, my country, Kenya. Is there anything that justifies a mother delivering on tarmac at the gate of a facility that should be taking care of her?
Thank you. Thank you very much, Imasi. My name is Margaret Kobi. I come from Kenya, Nairobi. And I just want to respond to that unfortunate incident where a mother actually delivered around the gate. That is an example of what should it happen if all the systems were working well. But the incident happens, and I think we should take it as a lesson. That's not what we want to see happening to the women anywhere in this country. Therefore, I would say in my case, one of the demand that is facing our country, and from where I sit, is the demand for inclusion so that women have an opportunity to participate in decision making on matters that concern their own lives. Therefore, that was quite unfortunate, and what that teaches us, mercy, is that you can have very wonderful policies, strategies, which is saying what should happen. In Kenya, we have universal health coverage, and we have the Linda Mama program, which have worked very well. But one incident like this, which happened when the one hospital was on strike, cannot be excused. But that it tells you, just having policies and systems and strategies in place, you need more than that to ensure that the systems actually work and they serve the women and the children according to their needs.
Well, thank you for your response, Dr. Kubik. Now I'll go back to Dr. Vardhan, and maybe all of you can just, keep reflecting what I've said in mind, and that should form the basis of, the discussions we're having today. And when we talk about respect and dignified care, those are some of the things we just don't want to hear of or see. And Professor Kobia talks about responsive policies and ensuring women sit in decision-making tables and all that. Dr. Harsh, how can governments ensure that, the notion of safe motherhood is expanded beyond the prevention of morbidity or mortality to look at the respect for women's basic human rights and, preferences during maternity care, especially during this period? And, when you talk about preferences, we're talking about, the ability to help them decide which kind of birth they want to go through or how they want to deliver their children, and not being forced to choose a particular way because we maybe want to decongest our hospitals during COVID and all that. So how do we ensure that we look at that and focus on things beyond mortality and morbidity?
Mercy, I strongly believe and agree that women must be empowered to decide for themselves, and therefore we have been trying to utilize multiple contact points through the antenatal and childbirth period to help women make informed decisions around safe motherhood practices, choice of birth companion, identifying referral transport, and postpartum contraception, to name a few. I would also like to add that right now India is transitioning towards a phase of moderate levels of maternal mortality, and our analysis have shown that many of the maternal deaths occur due to delay in timely provision of comprehensive obstetric care. As a clinician myself, I understand that most of this morbidity and mortality could have been prevented through timely caesarean sections. We believe that with better quality of public health care facilities, regular caesarean section audits, adherence to SOPs in the labor room through structured interventions, we shall be able to progress faster. Another important step towards universalization of skilled birth care is introduction of midwifery nurse practitioners in India. We have prepared a detailed roadmap with an aim to scale out midwifery services throughout the country. To sum up, respectful maternity care is a top priority for India, and we are working with a multitude of service providers to this end.
Thank you very much, Dr. Harsh. And I'll just end it there on respectful maternity care. But please, ladies and gentlemen, keep discussing on chat, keep discussing on social media, because this is not something that ends today. Even after these 4 hours, we still need to push for the rights and health and well-being of women, of maternal, child, newborn and adolescent health. Now, there are dozens of women who are watching you now, Dr. Harsh, from your country, India, and hundreds, thousands from all over the world. They are demanding for quality, dignified, and respectful maternal health services. Can you commit to that?
India has been a strong proponent of democratic systems, and we believe in hearing out the voices of the people and respecting their views, opinions, and demands. India is one of the countries that was instrumental in shaping this PMNCH call to action, and we reiterate our commitment to the women, children, and adolescents of India, and we will continuously direct our efforts towards improving their health and well-being. I will also urge the government counterparts and the wider PMNCH community to come forth and state and commit their support and resources towards this call to action and greater good. Let's ensure health for all and that no one is left behind.
Thank you very much, Honorable Dr. Harsh Vardhan, and thank you for your insights and your pledge. Please remain on screen, and for any of our viewers, the audience, if you have any questions for any of these panelists, please put it down on chat or just share your experiences and thoughts, and Jen will pass some of the questions to me and we'll be able to shoot them to this amazing panel that we have. Now let's talk about water sanitation and hygiene. And we all know that action in the wash sector is very critical for both containing the coronavirus and lowering its immediate impact in aftermath. So safe wash services, they are very essential, not only in the healthcare facilities, but in our communities. We're looking at improved hand washing behavior, food hygiene, safe water practices, and these are really essential to prevent further transmission. I will start with you, Pauline. What has your experience been in the last 6 months as a youth, especially navigating COVID-19 and accessing essential wash services?
Thank you very much, Mercy. So over the last 6 months, first of all, I come from, my organization is called Organization of Africa Youth Kenya, and we are a youth-led organization and also a lead partner for the PMNCH advocating for change for adolescents toolkits. So my line of work is mainly with adolescents and young people, and for the last 6 months, or at the beginning of the pandemic, we conducted a survey with adolescents and young people, basically the people that we work with, on the impacts of COVID. And just to say the least, wash is more pronounced during this pandemic. And because of the control measures for the pandemic that require that you wash your hands for a minimum of 20 seconds, and that is after almost contact with everything that you come across. I assure you that young people, adolescents and young people have had quite a task, and some of them have had to travel or to walk long distances to fetch water. And then when you come back with your water, you are torn between using it for drinking, for cooking, or just putting it aside for washing your hands and disinfecting the surfaces. And most of for adolescent girls that have just had their first menses. So you can imagine if you're an adolescent girl living in Kenya in the middle of a pandemic and you don't have access to water, you don't have access to soap, you don't have access to the basic PPEs that are required, like hand sanitizers. It's been quite a task. And I think it's good to be having our decision makers on this virtual engagement platform. At least I'm sure they've had a chance to see some of these things that are happening in our country, especially regarding wash, especially during this pandemic. People living in the cities have no access to water because sometimes the cost of water is high. You find that in some places a unit of water goes for $3, and you find that the requirements of this pandemic are so, for the control of the pandemic, require a continuous supply of water and clean water for that matter. So it's been quite a task, and young people have had quite a challenge navigating through the pandemic. And in addition to that, having to weigh between using your money, your hard-earned money, which has the pandemic has been has posed a challenge to livelihood sources. So you can imagine having to choose between buying food and buying water for cleaning or for just ensuring that you are in a sanitized place so that you are able to curb the spread of this COVID-19. So young people and adolescents have had quite a task managing through the pandemic. However, as an organization, we've been able to train young women. In some parts of the country, in Kisumu County, we were able to train young women on soap making, so that in addition to
Pauline, allow me
so that
just before you go into what your organization is doing, allow me to bring Professor Margaret Kobier again back here and just ask you this question. Professor Kobier, as Pauline says, access to wash services is considered a luxury for millions of Kenyans. Now, why should I as a woman choose between drinking water, washing my hands, or even taking a bath during my periods? And as you reflect on this, is the Kenyan government contemplating on building long-term, sustained solutions and behavior change when it comes to resilient wash programs in relation to women and adolescents and girls?
Thank you very much, Mercy. What Pauline is saying is true. In Kenya, we do experience that 50% of the Kenyans do not have access to water. And for that reason, you can imagine now when COVID set in, the demand for such a service. Therefore, what generally we understand is women want clean health facilities, including the toilets and including the bathrooms. So what has the Kenya government done in that connection? Of course, Mercy, you must understand also, government takes care of everybody, the 50 million or so. And so sometimes there are not enough resources to reach everywhere. But the government also sets a minimum standard that must at least be achieved to be able to benefit from the resources that the country has. So the Kenya government vision is actually to have a clean, healthy nation free from sanitation and hygiene-related diseases. I think the Ministry of Health has already demonstrated that if we hand water, besides saving women time they go to fetch water, would cut down also on diseases that come to the citizen. Therefore, the government has prioritized access to water to improve sanitation from 50% to something like 80%, and by the year 2030, we want to see 100% of access to sanitation and hygiene, and especially water. In the informal sector, the government during COVID, it has already dug about 100 boreholes in Kibera, for those of you know, and the other places like Mkuk, Kwajenga. And also in our country, in the rural area, the government has dug some dams. We have also gone towards implementing what we call Kenya Environmental Sanitation Policy, and also we have Ministry of Policy, which also has strategies of how we increase access to water and sanitation in both across the country. Therefore, one is trying to work very hard, increase the budget to have access, because we must have access to water. So our unit is to what extent every year are we having more women and girls access water for their own domestic use, and of course with this increased demand now of COVID. The other area is government has also partnered with the civil societies, and I think that's where Pauline would come in, that we are struggling to answer the question, how do we train women and girls so that they can be able to access water, and even how can they go with these boreholes that have been established and go to some small businesses, how they run this water so that they can be able to use as a way of motivating. Therefore, working with the private sector, working with the communities, Nyumba Kumi in particular, Nyumba Kumi is the smallest structure. It's the one which will make sure there's a water point, the water point is safe, and everybody is getting access. Therefore, the government has been working hard on these areas. Of course, sometimes the resources are not enough, and not every, but I can tell you, we have increased right now. We have about 18 million children, girls and the younger children going to school. And what the government has decided, every school must have water, must have soap, and must also be able to sanitize if our schools are going to open. Therefore, what the government has done has set more spotlight on the need for improved sanitation and hygiene more than before. Therefore, I see a situation where the government is also appreciating what the UNICEF had done with the WASH program, which was here in Kenya. It has worked in 11 counties, and we hope with this increased demand, we can move from 11 counties to more than maybe close to 20. So with those commitments of why haven't we fulfilled our commitment in the past, the resources have been a problem, and that's why partnership is very key. And we can count several organizations who have partnered in Kenya to improve access to water, and also to be able to improve the policies moving towards improving the sanitation for women and girls. Of course,
and allow me to stop you there.
Okay.
Mentioning partnerships and resources, and I think that's to build those partnerships. And allow me to end this panel here, and our heartfelt gratitude to you all, Dr. Vardhan, Professor Margaret Kobe, and Pauline Anyona, for your amazing insights on respectful and dignified care, and also WASH. And now you'll allow me to move to the second panel in this session that will discuss issues around essential sexual and reproductive health services and supplies, and more and better trained midwives. So joining me on stage are Ms. Oriana Lopez Uribe, Executive Director of Balance and spokesperson for Maria Fund. Maria being the Spanish acronym for Women